As Connecticut, the country, and the world continues its fight against COVID-19, 2021 has really proven itself to be the year of the vaccine. It was a year defined by the amazing things that vaccines have been able to do in our fight against the pandemic. Unfortunately, it's also been defined as the one big thing they haven't been able to do yet: end the pandemic. Nationally, the pandemic's darkest days were at the start of 2021. According to Johns Hopkins coronavirus tracker, 46,500 Americans died of COVID in just the first 2 full weeks of the year. That's over 3,300 deaths a day. By February 22nd, the total for the pandemic hit 500,000. Now, here in Connecticut, the state reached 7,000 total deaths on January 28th. But all in all, our winter wave was far less severe. And by that point, it was starting to recede, and hope was growing that this was the beginning of the end of the pandemic.
We were going through a winter surge. Our staff was tired, having been through this for almost close to a year. But at the same time, there was so much optimism.
Pfizer and Moderna's vaccines had started rolling out in late 2020. Then on February 22nd, the FDA greenlit a third COVID vaccine, the one-shot Johnson & Johnson vaccine. It's more shelf-stable, and it made it easier to vaccinate people in hard-to-reach areas.
We've made so much progress scientifically in a very, very short time span. And here we are, within 12 months of the pandemic starting, we had not 1, 2, but 3 vaccines.
Although Connecticut hit a total of 8,000 deaths on April 19th, we also hit a peak of about 50,000 shots given a day by that time, and the pace of new deaths started to slow. But on April 23rd, a hiccup. The FDA and CDC paused the J&J vaccine over safety concerns, although that pause only wound up lasting 10 days.
These rare cases, side effects that we saw with Johnson & Johnson, for instance, in the U.S., is exactly what the system is supposed to detect. It's a needle in a haystack. And, that should reassure the public.
The pace of vaccinations slowed in the following months, but the progress was undeniable. By mid-May, half of Connecticut's population was fully vaccinated, and the CDC changed its guidance to say fully vaccinated people didn't need to mask up in most public settings. Then by late June, positivity rates were under 0.5% consistently in Connecticut. The end seemed near.
Truly, we'll be putting this pandemic to bed and, fight this virus off for once and for all. But then we started seeing this new variant called Delta.
The Delta variant changed the whole feel of the year and the whole course of the pandemic. By July 7th, it had become the dominant strain in the U.S. Cases surged. By September 7th, the U.S. hit 40 million confirmed cases, and by October 1st, 700,000 people died, the most for any respiratory virus outbreak in U.S. history. And between Delta and now the even more mutated Omicron variant, it's looking more and more that while the pandemic will die off someday, the virus may not.
This time around, it's here to stay. And I won't be surprised if this becomes an annual thing where we need to get a vaccine, a booster shot. But this virus isn't done with us yet.
But that's not a disaster scenario by any means. I just want to pinpoint what vaccination has been able to do already. Now, the pandemic was around for an even 300 days of the year 2020. If you compare that to the first 300 days of this year, take a look at this number. More than anything else, we've managed to cut the amount of deaths in half. And that, more than anything else, was the real goal of the vaccination campaign.